Understanding the chest press machine.
The chest press machine is a popular tool for building upper body strength. It targets your chest, shoulders, and triceps by simulating a pushing motion. Learning to use it correctly can help you achieve better muscle activation, reduce injury risk, and maximize each workout. Let's explore how to adjust the machine and perform the exercise with the right technique.
Setting the seat height.
Start by adjusting the seat height so the handles are level with the middle of your chest. Sit down and check that your feet are flat on the floor and your back is firmly against the seat pad. Proper seat height helps align your arms and shoulders, targeting the correct muscles and minimizing shoulder or joint strain.
Choosing the right grip placement.
Most chest press machines offer multiple grip options. Choose a grip where your wrists remain straight and your elbows are bent at about 75 to 90 degrees when you hold the handles. A standard, shoulder-width grip works for most people. Using the correct grip ensures equal muscle engagement and protects your wrists and shoulders.
Maintaining proper form during the exercise.
Maintain good posture throughout the movement. Keep your back pressed against the pad, core engaged, and avoid arching your lower back. As you press the handles forward, exhale and extend your arms without locking your elbows. Inhale as you return to the starting position. Controlled, steady movement helps you get the most out of each repetition.
Tips for effective and safe workouts.
Start with a light weight to focus on your form before increasing resistance. Avoid sudden or jerky movements. Rest between sets and listen to your body. Stop if you feel pain in your joints or shoulders. Regularly reassess your seat and grip to ensure ongoing comfort and effectiveness as your strength improves.